Question 1. A 68-year-old male with a history of COPD is admitted with worsening dyspnea. He is restless, tachypneic at 32 breaths per minute, using accessory muscles, and has oxygen saturation of 86% on 2 liters nasal cannula. Arterial blood gas shows pH 7.30, PaCO2 55 mm mercury, PaO2 60 mm mercury. Which action should the nurse take first? A. Increase oxygen flow rate to 6 liters via nasal cannula. B. Prepare for non-invasive positive pressure ventilation, BiPAP. C. Administer prescribed bronchodilator nebulizer treatment. D. Reposition the patient to high Fowler's position. Answer. B. Prepare for non-invasive positive pressure ventilation, BiPAP. Rationale. This patient is in acute respiratory failure with hypercapnia. While positioning and bronchodilators help, the priority is airway and breathing support. BiPAP improves ventilation and reduces CO2 retention, directly addressing the most critical issue. Question 2. A postoperative patient suddenly develops stridor, agitation, and oxygen saturation of 82%. The patient is clutching their throat and unable to speak. What is the nurse's priority action? A. Call the rapid response team. B. Administer oxygen via non-rebreather mask. C. Prepare for immediate intubation. D. Assess surgical site for bleeding. Answer. C. Prepare for immediate intubation. Rationale. Stridor indicates upper airway obstruction, which is life-threatening. Securing the airway is the highest priority. Calling for help is important, but immediate airway management must begin simultaneously. Question 3. A 54-year-old female with sepsis becomes hypotensive, BP 78/40 millimeters of mercury, tachycardic, and confused. Her respiratory rate is 28 breaths per minute with shallow breathing. Which intervention should the nurse initiate first? Administer IV broad-spectrum antibiotics. B. Begin aggressive IV fluid resuscitation. C. Apply high-flow oxygen. D. Insert a urinary catheter for monitoring. Answer C. Apply high-flow oxygen. Rationale. Using ABC priority, airway and breathing come before circulation. The patient shows signs of hypoxia and respiratory distress. Oxygen must be administered immediately before addressing circulation with fluids. Question 4. A patient with a tracheostomy suddenly becomes cyanotic and restless. The nurse notes no airflow from the tracheostomy tube. What is the nurse's first action? A. Remove the tracheostomy tube. B. Suction the tracheostomy tube. C. Call the healthcare provider. D. Administer oxygen via face mask. Answer. B. Rationale. The most likely cause is mucus plug obstruction. Suctioning is the fastest way to restore airway patency. Removing the tube is only done if suctioning fails. Question 5. A trauma patient presents with unequal chest expansion, absent breath sounds on the right side, and tracheal deviation to the left. Vital signs show hypotension and tachycardia. What is the priority intervention? A. Administer IV fluids rapidly. B. Prepare for chest tube insertion. C. Provide high-flow oxygen. D. Assist with needle decompression. Answer D. Assist with needle decompression. Rationale. This is a tension pneumothorax, a life-threatening condition. Immediate decompression is required to restore breathing and circulation. Oxygen and fluids are supportive, but not definitive. Question 6. A patient receiving opioids postoperatively becomes difficult to arouse, with a respiratory rate of 8 breaths per minute and oxygen saturation of 88%. What is the nurse's priority action? A. Administer naloxone. B. Stimulate the patient verbally. C. Apply oxygen via nasal cannula. D. Notify the healthcare provider. Administer naloxone. Rationale. This is opioid-induced respiratory depression. Reverse it with naloxone to restore breathing. Oxygen alone does not correct the underlying cause. Question 7. A patient with severe asthma is silent on auscultation, has a respiratory rate of 34 breaths per minute, and is using accessory muscles. What is the nurse's priority action? A. Administer IV corticosteroids. B. Prepare for intubation. C. Administer nebulized bronchodilator. D. Place the patient in high Fowler's position. Answer. B. Prepare for intubation. Rationale. A silent chest indicates minimal airflow and impending respiratory failure. Immediate airway support is critical before cardiac arrest occurs. Question 8. A patient with heart failure develops acute pulmonary edema, presenting with pink frothy sputum, severe dyspnea, and oxygen saturation of 84%. What is the nurse's first action? A. Administer IV furosemide. B. Apply CPAP or BiPAP. C. Place the patient in high Fowler's position. D. Administer morphine. Answer. B. Apply CPAP or BiPAP. Rationale. Positive pressure ventilation improves oxygenation and reduces fluid in alveoli rapidly. This directly addresses the breathing issue before medications take effect. Question 9. A patient with diabetic ketoacidosis is breathing rapidly and deeply, small respirations. Which action should the nurse prioritize? A. Administer insulin infusion. B. Start IV fluids. C. Provide oxygen therapy. D. Monitor potassium levels. Answer. B. Start IV fluids. Rationale. Although breathing is abnormal, it is compensatory. Circulation, severe dehydration is the primary issue. Fluid resuscitation restores perfusion and supports metabolic correction. Question 10. A patient is found unresponsive with no pulse and no breathing. What is the nurse's first action? A. Call a code blue. B. Begin chest compressions. C. Provide rescue breaths. D. Attach defibrillator. Answer B. Begin chest compressions. Rationale. According to ABC CAB priority in cardiac arrest, circulation, compressions, comes first. Immediate compressions maintain perfusion to vital organs. Question 11. A 72-year-old patient with a history of stroke suddenly develops drooling, difficulty swallowing, and a gurgling sound during respiration. Oxygen saturation drops to 88%. What is the nurse's priority action? A. Administer oxygen via nasal cannula. B. Perform oropharyngeal suctioning. C. Place the patient in high Fowler's position. D. Notify the healthcare provider. Answer. B. Perform oropharyngeal suctioning. Rationale. The gurgling sound indicates airway obstruction due to secretions. Clearing the airway takes priority over oxygen administration because oxygen will not be effective if the airway is blocked. Question 12. A patient with severe pneumonia becomes increasingly lethargic. Respiratory rate decreases from 28 to 10 breaths per minute, and oxygen saturation drops to 85% despite oxygen therapy. What is the nurse's priority action? A. Increase oxygen delivery. B. Prepare for intubation and mechanical ventilation. C. Obtain arterial blood gases. D. Encourage deep breathing exercises. Answer. B. Prepare for intubation and mechanical ventilation. Rationale. A decreasing respiratory rate with hypoxia indicates respiratory failure and impending arrest. Securing the airway and supporting breathing is the highest priority. Question 13. A patient with a chest tube suddenly develops shortness of breath, tracheal deviation, and absent breath sounds on the affected side. What should the nurse do first? A. Check for kinks in the chest tube tubing. B. Notify the healthcare provider. C. Prepare for needle decompression. D. Increase oxygen flow. Answer. A. Check for kinks in the chest tube tubing. Rationale. This suggests a possible tension pneumothorax due to chest tube malfunction. The first step is to assess for correctable causes, kinks, obstruction, before escalating interventions. Question 14. A patient receiving blood transfusion develops sudden dyspnea, chest tightness, and hypotension. What is the nurse's priority action? A. Stop the transfusion immediately. B. Administer oxygen. C. Notify the provider. D. Start IV fluids. Answer. A. Stop the transfusion immediately. Rationale. This is likely a transfusion reaction. The source of the problem must be removed first to prevent further harm before addressing ABC interventions. Question 15. A patient with anaphylaxis presents with wheezing, stridor, and hypotension. What is the nurse's first action? A. Administer IV fluids. B. Give intramuscular epinephrine. C. Apply oxygen. D. Prepare for intubation. Answer. B. Give intramuscular epinephrine. Rationale. Epinephrine rapidly reverses airway constriction and hypotension. It addresses both airway and circulation simultaneously and is the first-line treatment. Question 16. A patient with spinal cord injury at C5 level is noted to have shallow breathing and decreasing oxygen saturation. What is the nurse's priority intervention? A. Administer oxygen via mask. B. Prepare for mechanical ventilation. D. Monitor vital signs closely. Answer. B. Prepare for mechanical ventilation. Rationale. High cervical injuries impair diaphragmatic function, leading to respiratory failure. Definitive airway and breathing support is required. Question 17. A patient develops sudden confusion, restlessness, and oxygen saturation of 89% after surgery. Respiratory rate is 30 breaths per minute. What is the nurse's first action? A. Administer oxygen. B. Check hemoglobin level. Encourage deep breathing. D. Notify the healthcare provider. Answer. A. Administer oxygen. Rationale. Signs indicate hypoxia. Immediate oxygen administration addresses the breathing problem before further investigations. Question 18. A patient with massive gastrointestinal bleeding becomes pale, hypotensive, and tachycardic. The patient is alert but anxious. What is the priority intervention? A. Administer oxygen. B. Initiate large-bore IV access for fluids. C. Prepare for blood transfusion. D. Monitor vital signs. Answer. B. Initiate large-bore IV access for fluids. Rationale. This is a circulation problem due to hemorrhage. Rapid fluid resuscitation is critical to maintain perfusion and prevent shock. Question 19. A patient receiving tube feeding suddenly begins coughing, choking, and desaturating. What is the nurse's first action? A. Stop the feeding immediately. B. Suction the airway. C. Administer oxygen. D. Notify the provider. Answer. Rationale. The source of aspiration must be removed first. Continuing feeding worsens airway compromise. After stopping, airway management follows. Question 20. A patient with pulmonary embolism presents with sudden chest pain, dyspnea, tachycardia, and oxygen saturation of 85%. What is the nurse's priority action? A. Administer anticoagulants. B. Apply high-flow oxygen. C. Start IV fluids. D. Obtain ECG. Answer. B. Apply high-flow oxygen. Rationale. Pulmonary embolism causes impaired oxygenation. Immediate oxygen therapy is the priority to improve tissue oxygenation before other treatments. Question 21. A 60-year-old patient with a history of laryngeal cancer suddenly develops inspiratory stridor, hoarseness, and severe anxiety. Oxygen saturation drops to 83%. What is the nurse's priority action? A. Apply high-flow oxygen via non-rebreather mask. B. Prepare for emergency tracheostomy. C. Administer corticosteroids. D. Reposition the patient upright. Answer. B. Prepare for emergency tracheostomy. Rationale. Stridor indicates critical upper airway obstruction. Oxygen alone will not bypass the obstruction. A surgical airway is required immediately to secure airway patency. Question 22. A patient with severe sepsis is on oxygen via nasal cannula at 4 liters per minute. The patient becomes increasingly confused, with respiratory rate 34 breaths per minute and oxygen saturation 86%. Blood pressure is 82/46 millimeters mercury. A. Increase oxygen to non-rebreather mask. B. Start vasopressor infusion. C. Administer IV fluids rapidly. D. Obtain blood cultures. Answer. A. Increase oxygen to non-rebreather mask. Rationale. Using ABC priority, breathing must be corrected before circulation. The patient is hypoxic despite current oxygen therapy, requiring escalation to high-flow oxygen. Question 23. A post-operative thyroidectomy patient develops sudden neck swelling, difficulty breathing, and a feeling of choking. What is the nurse's first action? A. Remove sutures at the incision site. B. Call the rapid response team. C. Apply oxygen. D. Elevate the head of the bed. Answer. A. Remove sutures at the incision site. Rationale. This indicates a hematoma compressing the airway. Immediate release of pressure by removing sutures can be life-saving and must be done without delay. Question 24. A patient with acute asthma exacerbation suddenly becomes drowsy, with a respiratory rate decreasing from 30 to 12 breaths per minute and diminished breath sounds. What is the priority action? A. Administer bronchodilators. B. Prepare for intubation. C. Increase oxygen flow. D. Monitor arterial blood gases. Answer. B. Prepare for intubation. Rationale. Decreasing respiratory effort in asthma indicates fatigue and impending respiratory arrest. Immediate airway control is critical. Question 25. A patient with suspected opioid overdose is unresponsive with pinpoint pupils, respiratory rate of 6 breaths per minute, and oxygen saturation of 80%. What is the nurse's first action? A. Administer naloxone. B. Begin bag valve mask ventilation. C. Call for help. D. Apply oxygen. Answer. B. Begin bag valve mask ventilation. Rationale. Airway and breathing take absolute priority. Ventilation must be supported immediately before medication can take effect. Question 26. A trauma patient has a sucking chest wound with bubbling blood and severe respiratory distress. What is the nurse's priority intervention? A. Apply a 3-sided occlusive dressing. B. Administer oxygen. C. Prepare for chest tube insertion. D. Position the patient on the affected side. Answer. A. Apply a 3-sided occlusive dressing. Rationale. This prevents air from entering the chest cavity during inspiration, while allowing air to escape. It immediately stabilizes breathing. Question 27. A patient with acute heart failure suddenly becomes confused, with frothy sputum and oxygen saturation of 82%. Respiratory rate is 36 breaths per minute. What is the nurse's first action? A. Administer IV diuretics. B. Apply CPAP. C. Administer morphine. D. Obtain chest X-ray. Answer. B. Apply CPAP. Rationale. Positive airway pressure improves oxygenation rapidly and reduces pulmonary edema. It directly addresses the breathing emergency. Question 28. A patient with diabetic ketoacidosis is lethargic with Kussmaul respirations and fruity breath. Blood pressure is 88/50 millimeters of mercury. What is the nurse's priority intervention? A. Administer insulin. B. Start aggressive IV fluids. C. Provide oxygen. D. Monitor glucose levels. Answer. B. Start aggressive IV fluids. Rationale. Circulation takes priority due to severe dehydration and hypotension. Fluid resuscitation is the first step before insulin therapy. Question 29. A patient develops sudden airway obstruction from a foreign body and becomes unable to speak or cough. What is the nurse's immediate action? A. Perform Heimlich maneuver, abdominal thrusts. B. Call for help. C. Provide oxygen. D. Begin CPR. Answer. A. Perform Heimlich maneuver, abdominal thrusts. Rationale. Complete airway obstruction requires immediate intervention to clear the airway. Waiting or providing oxygen is ineffective without airway patency. Question 30. A patient with a massive pulmonary embolism becomes hypotensive, tachycardic, and hypoxic. Which action should the nurse prioritize? A. Administer thrombolytics. B. Apply high-flow oxygen. C. Start IV fluids. D. Prepare for intubation. Answer. B. Apply high-flow oxygen. Rationale. Severe hypoxia must be corrected immediately. Oxygenation is the priority before addressing circulation or definitive treatment. Question 31. A 66-year-old patient with advanced COPD becomes increasingly somnolent. Respiratory rate drops to 8 breaths per minute. Oxygen saturation is 82% on 4 liters nasal cannula. An ABG shows severe respiratory acidosis. What is the nurse's priority action? Increase oxygen to 10 Ls via mask. B. Prepare for endotracheal intubation. C. Administer bronchodilator therapy. D. Place the patient in high Fowler's position. Answer. B. Prepare for endotracheal intubation. Rationale. The patient is experiencing respiratory failure with hypoventilation and CO2 retention. Definitive airway management is required immediately. Question 32. A postoperative abdominal surgery patient suddenly becomes restless, tachypneic, and reports sharp chest pain. Oxygen saturation drops to 84%. A. Apply high-flow oxygen. B. Notify the healthcare provider. C. Prepare for CT scan. D. Administer anticoagulants. Answer. Apply high-flow oxygen. Rationale. Suspected pulmonary embolism with hypoxia requires immediate oxygenation before further diagnostics or treatment. Question 33. A patient with a tracheostomy accidentally dislodges the tube and begins to show signs of respiratory distress. What is the nurse's priority action? A. Cover the stoma with sterile dressing. B. Attempt to reinsert the tracheostomy tube. C. Call the rapid response team. D. Provide oxygen via face mask. Answer. B. Attempt to reinsert the tracheostomy tube. Rationale. Airway must be re-established immediately. Reinsertion is the fastest way to restore ventilation. Question 34. A patient receiving sedation for a procedure becomes unresponsive with shallow breathing and oxygen saturation of 85%. What is the nurse's first action? A. Administer reversal agent. B. Begin bag valve mask ventilation. C. Call the provider. D. Apply oxygen. Answer. B. Begin bag valve mask ventilation. Rationale. Airway and breathing take priority. Immediate ventilation support is required before medications take effect. Question 35. A patient with severe pneumonia suddenly develops cyanosis, decreased breath sounds, and confusion. Respiratory rate is 10 breaths per minute. What is the nurse's priority intervention? A. Administer antibiotics. B. Prepare for intubation. C. Increase oxygen delivery. D. Obtain sputum culture. Answer. B. Prepare for intubation. Rationale. Signs indicate respiratory failure and impending arrest. Securing the airway is critical. Question 36. A patient with acute myocardial infarction becomes hypotensive, BP 70/40 mm of mercury, tachycardic, and diaphoretic. What is the nurse's priority action? A. Administer oxygen. B. Initiate IV fluid bolus. C. Prepare for vasopressors. D. Obtain ECG. Answer. B. Initiate IV fluid bolus. Rationale. Circulation is compromised. Immediate fluid resuscitation is needed to maintain perfusion. Question 37. A patient develops laryngeal edema after an allergic reaction and begins to exhibit stridor and difficulty breathing. What is the nurse's first action? A. Administer epinephrine. B. Apply oxygen. C. Prepare for intubation. D. Administer antihistamines. Answer. A. Administer epinephrine. Rationale. Epinephrine rapidly reduces airway swelling and improves breathing. It is the first-line treatment in anaphylaxis. Question 38. A patient with head injury begins to vomit and becomes less responsive, with gurgling respirations. What is the nurse's priority action? A. Turn the patient to the side. B. Suction the airway. C. Administer oxygen. D. Notify the provider. Answer. B. Suction the airway. Rationale. Airway obstruction from vomitus is the immediate threat. Clearing the airway is the top priority. Question 39. A patient with severe burns develops hoarseness, singed nasal hairs, and increasing respiratory distress. What is the nurse's priority action? A. Administer IV fluids. B. Apply oxygen. Prepare for early intubation. D. Monitor vital signs. Answer. C. Prepare for early intubation. Rationale. Signs indicate inhalation injury with impending airway edema. Early intubation prevents complete airway obstruction. Question 40. A patient in septic shock is hypotensive, tachycardic, and hypoxic despite oxygen therapy. What is the nurse's priority action? A. Administer vasopressors. B. Increase oxygen delivery method. C. Initiate fluid resuscitation. D. Obtain blood cultures. Answer. B. Increase oxygen delivery method. Rationale. Even in shock, ABC priority dictates correcting hypoxia first. Escalating oxygen support is critical before addressing circulation. Question 41. A 70-year-old patient with a history of stroke suddenly develops snoring respirations and becomes difficult to arouse. Oxygen saturation drops to 87%. What is the nurse's priority action? A. Administer oxygen via nasal cannula. Perform a head tilt chin lift maneuver. C. Insert an oropharyngeal airway. Answer. B. Perform a head tilt chin lift maneuver. Rationale. Snoring respirations indicate airway obstruction by the tongue. Repositioning the airway is the fastest and most immediate intervention to restore patency. Question 42. A patient with advanced pneumonia becomes cyanotic with minimal chest movement and a respiratory rate of 6 breaths per minute. What is the nurse's first action? Answer. B. Begin bag valve mask ventilation. Rationale. The patient is not ventilating adequately. Immediate manual ventilation is required to support breathing before definitive airway management. Question 43. A patient receiving total parenteral nutrition suddenly develops air hunger, chest pain, and hypotension. A central line is in place. What is the nurse's priority action? A. Clamp the central line. B. Administer oxygen. C. Place the patient in left lateral Trendelenburg position. D. Notify the healthcare provider. Answer. A. Clamp the central line. Rationale. Suspected air embolism. The source must be stopped immediately to prevent further air entry before other supportive actions. Question 44. A patient with acute respiratory distress syndrome, ARDS, becomes increasingly hypoxic despite high-flow oxygen, with oxygen saturation of 80%. What is the nurse's priority action? Increase oxygen further. B. Prepare for mechanical ventilation with PEEP. C. Reposition the patient. D. Administer sedatives. Answer B. Prepare for mechanical ventilation with PEEP. Rationale. Refractory hypoxemia requires advanced ventilatory support. PEEP improves oxygenation by keeping alveoli open. Question 45. A patient post-extubation suddenly develops stridor and severe respiratory distress. What is the nurse's priority action? A. Administer corticosteroids. B. Apply oxygen. C. Prepare for reintubation. D. Encourage coughing. Answer C. Prepare for reintubation. Rationale. Post-extubation stridor indicates airway swelling and obstruction. Immediate airway control is necessary. Question 46. A patient with massive hemorrhage becomes unresponsive with weak pulses and hypotension. Respiratory rate is 28 breaths per minute. What is the nurse's priority action? A. Administer oxygen. B. Initiate massive transfusion protocol. C. Establish large bore IV access. D. Monitor vital signs. Answer C. Establish large bore IV access. Rationale. Circulatory collapse requires rapid access for fluids and blood. This enables life-saving resuscitation. Question 47. A patient with Guillain-Barré syndrome develops progressive muscle weakness and shallow breathing. Vital capacity is significantly decreased. What is the nurse's priority action? A. Administer oxygen. B. Encourage deep breathing exercises. C. Prepare for intubation. D. Monitor neurological status. Answer. C. Prepare for intubation. Rationale. Neuromuscular failure leads to respiratory collapse. Early intubation prevents sudden arrest. Question 48. A patient with severe allergic reaction suddenly collapses with no pulse and no breathing. What is the nurse's first action? A. Administer epinephrine. B. Begin chest compressions. C. Call for help. D. Provide ventilation. Answer. Begin chest compressions. Rationale. In cardiac arrest, circulation takes priority. CAB. Immediate compressions are essential to maintain perfusion. Question 49. A patient with liver failure becomes confused and develops shallow breathing with oxygen saturation of 85%. What is the nurse's priority action? A. Administer oxygen. B. Assess ammonia levels. C. Prepare for intubation. D. Notify the provider. Answer. A. Administer oxygen. Rationale. Hypoxia must be corrected immediately. Oxygen therapy addresses the most urgent breathing issue. Question 50. A patient with severe trauma is unresponsive, with labored breathing and a weak, thready pulse. What is the nurse's priority sequence of actions? A. Circulation, airway, breathing. B. Airway, breathing, circulation. C. Breathing, circulation, airway. D. Circulation, breathing, airway. Answer. B. Airway, breathing, circulation. Rationale. In non-cardiac arrest trauma, ABC remains the priority. Securing airway and ensuring breathing precedes circulation management.
In critical care, seconds decide survival, and the ABC framework remains your strongest clinical weapon. Every question you've just solved reinforces one truth. Priority is not about knowledge alone. It's about rapid clinical judgment under pressure. Airway always comes first when obstruction is present. Breathing takes priority when oxygenation fails. Circulation dominates when perfusion collapses. But in real Nclex scenarios, these priorities shift fast, testing not what you know, but how you think. Master this pattern, and you don't just pass questions. You control emergencies before they escalate. Keep drilling, keep refining your instincts, and turn every scenario into automatic decision-making.